Today on Fluorosis Files with Mama Maji, we are at Metropolitan Hospital, Buruburu. Many of you have asked me, what is skeletal fluorosis? Come with me as I engage Dr. Faraj Omar Alkizim as he tells us about skeletal fluorosis, the clinical presentation, and much more. So come with me.
My name is Dr. Faraj Alkizim. I'm an orthopedic and spine surgeon. I practice general orthopedics, which is basically trauma, joints, spine surgery, arthroscopy, joint replacements, etc. The whole range of orthopedic and spine. That's basically my practice. And robotic surgery of late, I've just been reminded, sorry. Robotic surgery is something that we are pioneering. It's new in the country. And I've had the privilege of spearheading it and supporting the establishment of the service in the region. Skeletal fluorosis is a condition, metabolic condition, that comes about from the deposition of fluoride in the musculoskeletal system. Now, musculoskeletal system ranges from muscles, tendons, and then skeletal, the bone, so that the bone joins muscle, tendons, ligaments, etc. So you have deposition of high fluoride within them that then leads to calcification and also derangement of the basic metabolism within the bones and the joints that brings about symptomatology that is related to those structures that we've just mentioned. Mostly at early stages, we would probably have general body pain, so bone pain, generalized pain from the joints, from the bones, and then as it progresses, then it depends on where the deposition is. So you probably now start having stiffness in the joints, so that interferes even with how somebody walks. You start having calcification in the structures that I mentioned, so you start having now mechanical pressure from such calcification. So for example, in the event that ligaments within the spine, for example, the ligamentum flavum has calcification within it, then it may cause pressure to nerve roots, to spinal cord, and now that will bring about neurological deficits. So it really depends on where exactly the deposition takes place, and that then brings about the relevant symptomatology that would present. So for example, most of the times, if it is nerve root related, then pain that is radicular, that basically means that nerve kind of pain that is traveling down a specific pattern. If it's in the lower back, then you probably have sciatica kind of a pain that is radiating down to one of the legs. Apart from the pain, then also neurology involves sensation. So you'd have numbness in specific areas of what we call dermatomes, depending on which nerve root has been affected. If it is higher in the spine, then you may have mechanical pressure on the spinal cord itself, which would now cause more generalized neurology, for example, weakness, for example, numbness in a broader area, for example, stiffness, etc. Yeah, generally anyone can get skeletal fluorosis, and right now with the kind of water that we're consuming, with all the urbanization and the use of boreholes, most of us are probably exposed, and I don't think good water testing is being done on the water that is being consumed. There are all these water kiosks all over. We don't know the sources of the water, so anyone can be exposed because anyone is at risk. Pathological fractures are fractures that occur because of a certain pathology, as the word suggests. So now that is basically an abnormality of the bone. So it could be anything ranging from something invading the bone, for example, tumors, to something that is now making the bone brittle, like fluorosis. So that now if you have accumulation of fluoride, because bones, the mineral content of bone is calcium hydroxyapatite, so that's more calcium with other molecules that are bonding to provide the mechanical tensile strength of the bones. So when you have now deposition of fluorosis, which doesn't have the similar mechanical strength, then now the bone tends to become brittle and easily fractured, and that could be one of the presentations in severe cases of skeletal fluorosis. One is the lab tests, and also there are imaging modalities. Lab tests would be urine and blood tests of fluoride concentrations, but of course that tends to give you a short-term period of representation of the fluoride levels that is circulating within the body. Now in imaging, then there tends to be sclerosis of the bone, although that is also very general and you'd really need to support it with further investigations to confirm that this is indeed skeletal fluorosis. On the spine, you just probably see some lesions when there's calcification. For example, there's a patient I operated on not very long ago who presented to me, and it's something that looked like a tumor invading the spine. And when we went in to remove a tumor, we found uric acid crystals that was actually present, causing the symptomatology from the pressure. So in the event now, if you can postulate, then you would find that some mass effect in the spine could be also fluorosis. Then you know, it may not be very specific imaging, but then any abnormalities that would then be supported with fluoride-specific investigations would probably be now diagnostic. Most of the times, management would be symptomatic. So 1, pain; 2, joint care, for example, now physiotherapy, joint support. In the event that now the joints are destroyed, then we'll probably need to do joint replacements. By the way, we're seeing a lot of increasing osteoarthritis that is presenting, and we are attributing it to increased sedentary lifestyle, etc. However, I don't think there are studies that have been done to verify whether it is indeed sedentary, or could it be that fluorosis is also contributing? Who knows? So that is now the surgical aspect. In the event that there is mechanical pressure from calcified structures, like the example I gave you, then surgical becomes a condition. But I don't think there is a specific treatment for fluorosis to bring down fluoride level. Supportive care, and one is probably cut off the intake of the fluoride, and then with time, with bone remodeling, then it should be able to now clear up from the skeletal system. Yeah. I think skeletal fluorosis is a less diagnosed condition, not very commonly diagnosed for various reasons. One is difficulty in indeed diagnosing it. 2 is the lack of very specific findings and very specific investigations relevant to it. However, it is an area that is neglected, so we don't have data that is supporting in terms of incidences and prevalences or disease occurrence of fluorosis. However, it is increasingly becoming common, especially from sentiments from our colleagues in the dental surgical field, that there's a lot of oral fluorosis that is appearing, and therefore, I mean, you don't expect that the fluoride is only depositing in teeth. Then you expect that it will also be depositing in the musculoskeletal system. Now, 2 is that there is more and more unsafe water being consumed. Therefore, there is a lot of occurrences of the fluorosis. Now, since it's a condition that is not easily diagnosed and not easily treated, then the best thing would be to prevent such a condition. So how do we prevent it? Then one is that you want to be careful with the kind of water intake that one is taking, because of course, as we commonly know, prevention is better than cure. So if we can prevent it, then we would not have to struggle with diagnosing and treating it and having to deal with the complications. So I think the best approach for a condition like this that is quite gray, then is just prevent it at all costs. And therefore one must be very careful with what they take in terms of their water intake, in terms of other sources of fluoride. So prevention is probably better than having to pursue cure. Together for a fluorosis-free future.